right, welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and we have a fantastic episode for you today. It's fantastic because the subject matter is incredibly relevant, but more importantly, my guest is my sister. So, some of you know my sister because she is my sister and also has been working alongside me for over 10 years. Over 10 years. And we're beyond blessed to have her in the practice. And she's near and dear to me for so many reasons, but also because of her own personal medical journey and challenges, notably her battle with breast cancer. And you're now 15 years?
13.
13 years free and clear. So that is fantastic. Today's episode is actually not about breast cancer, but because we did an episode on breast cancer, but today's episode is about breast preparedness, breast surgery preparedness. I'm about to undergo breast surgery, breast lift, breast reduction, breast aug. And I want to know what I need to do to prepare from an oncologic, from a cancer, from a screening, from a preparedness standpoint. Now, every doctor has their own protocol, and you'll, of course, have that conversation with your doctor. But I think that you need to always be your own advocate because, as we have now talked about for almost 5-6 years on the show, some offices, some doctors, some medical environments are not up to standard. And you are on listening to this show because you want to get the skinny, the knowledge, the best information. So what we're going to do is, first we're going to talk about your own journey, how you were diagnosed, and sort of the basics of the number one most important aspect of breast cancer prevention and or health is self-awareness, because that's what this is all about. You knowing your own breast, you knowing that something isn't right, you paying attention. And I'll tell you the steps that I take when it comes to my patients and their breast surgery preparedness list. Okay, so with that long introduction, welcome to the show, Terry.
Thank you. Thank you so much for having me.
All right. It's a big deal, guys. Terry hates public anything.
So my journey started in 2010, March 2010, and I had actually had my mammogram.
How old were you in 2010? 42? 42, yeah.
Mm-hmm. 42, and so I had already had my mammogram a few months back.
Annual mammogram. Terry is a CPA, so for those of you who know the CPAs, they're very methodical. You can't be like, oh, everything's great, but we're missing about $3. $3, where did $3 go? So it's all about checks and balances. So she gets her mammogram religiously every year. So you went and got your mammogram.
And everything looked great. And so I was like, okay, great, on to the next year. And I did do my, starting at 40, I started doing my breast exams, also very methodical and, every month. So this fast forward to March, that was back in August when I had my mammogram.
And 6 months later.
6 months later, I ended up, doing my breast exam, and I'm like, oh, I feel something. And I'm like, oh, it's probably nothing, very small, nothing out of the ordinary, I thought. Women's breasts are very, can be lumpy, depending on what time of the month it is. And so, but I thought, you know what? I just want to make sure. So I did get in touch with my gynecologist, and she was like, based on your history, based on your family's history, it's probably nothing, but just keep an eye on it and make sure, and get back to me if it's still there. Get back to me in about a week. And so, of course, I checked and every day, and it still was there. And I call her. She goes, you know what? And I was actually getting ready for my daughter's bar mitzvah in May. And so I thought, you know what, I will just go ahead and just make sure I don't have to worry about it. I want to go into the parties just, thinking I'm good, there's nothing wrong. And so I ended up going into the doctor's office. She goes, you know what, she checked me and she goes, I doubt that it's anything, but let's just go ahead and do a ultrasound and another mammogram. And then, of course, going in, and they ended up finding some calcification. And so she was like, you know what, it's probably nothing, but let's do a biopsy just to double make sure. So we ended up doing that, and of course, the rest is history. I was diagnosed stage almost 2 because I had already, it was a very aggressive tumor, and so it had already started going into my lymph nodes. And so the fact that I had checked and I was persistent pretty much saved my life, because if I had waited until after my daughter's bat mitzvah, I probably would not be here. So thank God for being methodical.
Yeah. See, there are benefits to being anal.
Yes. So that's that.
So this, as you were talking, I wanted to have a pen and paper and write things down, because there's so many key points for people to hear and listen. The story in and of itself is nothing shy of phenomenal, because let's back up here and go through things. Women will check their breasts periodically here and find thousands of lumps. It's like, it's normal. Breasts are cystic and lumpy, and as you said. So how the hell, oh my God. But it's not just the fact that it was lumpy. It's about the change. It was the fact that something wasn't there and was there and whatnot. So the first thing that you have to keep in mind is risk factors. You have 0 risk factors. I mean, 0. You don't smoke. We have no breast cancer history in our family. There's some other risk factors that people don't know. You had children early. You had multiple children.
And I breastfed.
And you breastfed. And you don't smoke, you don't drink. And so there was and you were 42. It wasn't like you were like a more traditional age of like 49, 53. And so absolutely nothing to worry about. And furthermore, you just had a normal mammogram. So a more casual person would have been like, fuck it, it's fine, it's whatever, it's a lump, and I'll ignore it. It wasn't painful, right? Right? So people assume or think that it's going to be painful. It's not. Nope. Tumors are not painful. Most of them have 0 pain. And it wasn't huge, right? It was very small.
It was a peanut size.
Like the size of a peanut.
Correct.
So that's number one. The second thing is the idea that one needs to do a self-exam. It's something that women are told and taught, but what percentage of women do you think of your friends actually do a self-exam?
Very low.
I would say 5%.
100%.
Meaning every month, same time, meaning it has to be the same time, because then you know that 2 weeks after my period, this seems normal. Because if you do that same exam 1 week after your period, you'll get a different exam. Correct. And the key to these exams is consistency. This is not normal for me.
Absolutely.
So this self-exam thing, it kind of seems like silly. We have mammograms, we have MRIs, we have all this advanced technology. I have a goddamn OB. What the hell am I going to know? You're going to know the most out of everyone. You know who is the second most common person to diagnose a breast cancer for a patient when it's outside of a doctor? Is the husband or boyfriend. Because it's all about knowing, hey, this wasn't here. And nobody knows that but you and your loved one or whoever. Nobody knows what your breast is like. So I can't stress, the story in and of itself should tell you everything, but I can't stress enough this idea that if you're not going to be your own advocate and do these exams, the key is every month. The key is same time of month. Ideally, you should wait about 2 weeks so that your post-menstrual changes have occurred, and you just have to do it. And then the third thing is not to ignore it. I mean, okay, so I did the self-exams, and I did it at the same time. And then I saw something, I was like, no, it's nothing. It doesn't mean that you go into panic mode every time there's a lump, but you need to stay on top of it. And I have not, your OB is fantastic, but you cannot rely on anyone else. So the OB said exactly what I would have said. Terry, you have no medical condition, you have no health, no risk factors, you have a lump, it's tiny, I wouldn't worry about it. 100% that's the right answer, because if every single person came in with a lump, we would probably be doing 400,000 biopsies a month. There's millions of women that have this. But at the same time, it didn't go away. It wasn't there before. They just did a mammogram, and you did the right thing, which is you went in and said, hey, let's double check. Then your OB did the right thing, which is she didn't dismiss you, because a lot of times you go to your OB and like, nah, get out of here. Well, then you need to be adamant. And you pushed and you pushed and you pushed. So the self-exam part is the most important discussion of today's episode, which is You cannot rely. Oh, furthermore, you're like, well, I don't really need to worry about it because the technology will catch it, right? And you didn't have a mammogram 10 years ago. You had a mammogram 6 months prior. From 6 months prior to the next mammogram, which was in March.
Correct.
Right? August to March, your mammogram changed.
Absolutely.
And then when they went back and looked at your first mammogram, this is what they said. Oh, I think I can make something out. In other words, knowing that you have it there with the new mammogram, and I don't mean it in a negative way, they missed it because it was so subtle. So that should scare you. That should scare you, meaning that they're going to miss it. It's inaccurate. It's not. It's fallible. It's not that effective. So you need to add your own part to this if you want to. And it's 1 in 7. It's not a small number of people that get breast cancer. It's not like whatever. What are the chances I'm going to get retinal cancer? No. It's very common. So that was the thing that I wanted to stress the most at the beginning was your journey, your survival, your persistency, and how it could have just, if any one of those check boxes you didn't persist, yeah, you're absolutely right. God forbid you wouldn't have been here. So number one is the recommendations by the medical community is at 40, you start getting your annual mammogram. So here's some of the discussions. If you have a history of breast cancer in your family, my mom, my sister, my aunt, these are immediate family members, especially at an early age. The recommendation is you start breast cancer screening earlier. I actually think it might even be up to 35. Secondly, there are thousands of women getting breast cancer at 28, 32, 30, and aggressive ones for that matter. So I almost want to say it's never too early, but definitely if you have family history of breast cancer, you start earlier. The next thing is there is some discussion that if your mammogram comes back normal, that you can do it every other year. I would argue that that's a horrible idea. Now, what if my insurance doesn't pay for it? So fucking what? It's $180 we send patients to go get a mammogram, okay? You can get a mammogram every year whether your insurance pays for it or not. Just imagine now Terry was due for a mammogram the next year and not that year because she was given a clear because she was the last person, she'd be dead. So annual mammogram, at least starting 40, earlier if you have any family history. That goes without saying. Now, what if I get an MRI instead? And the answer is that's not going to cut it. Unfortunately, right now, ultrasounds, mammograms, and MRIs are totally different. One doesn't supersede the other one. In other words, I don't want to get a mammogram. They squeeze the shit out of my breast. It hurts like hell. Nobody likes mammograms. They're horrible. As a matter of fact, they rupture implants if you go to somewhere that is not familiar with women with breast implants. And therefore, many women are actually not going to get a mammogram because it's an unpleasant experience. Having said that, unfortunately, mammograms still are one of the only ways to pick up certain signs of cancer, like microcalcifications. You can pick up other things in MRIs, but it doesn't substitute as of yet for other technologies. So you need to get a mammogram. Okay, you have to get a mammogram. There's no way around it. Now, in my practice, if you're about to get a breast surgery, okay, and you're 38 or 39, okay, and you're not due for a mammogram and you have no real major family history for it, I actually suggest, I don't require it, but I suggest you get a baseline mammogram before you have your surgery. Why? Because you're 38, you get a breast aug, you get a breast lift, you get a whatever, you go live your life. 2 years later, you're 40. You go in and go get your mammogram, they find something. They don't know what that something is. They don't know if it's surgery, artifact, if it was there before, is it because... So you want to walk up to your radiologist and be like, here you go. What's this? Oh, this is my mammogram before I had surgery. They will love you because it's all about points of comparison, right? Comparing the old one to the new. Oh, this looks different. That's what it is. It's not just what you find, but the fact that it wasn't there or it is there. So I suggest patients, if you're close to the age of 40, get a baseline mammogram just so you have it. archive it away. It's money well spent. It's good insurance, right? 100%. Then patients come in and they're like having surgery, and we say, you need to get a mammogram. I had a mammogram. When was your mammogram? 8 months ago. Doesn't cut it. What do you mean? It was 8 months ago. I'm not due for another 4 months, once a year. I require that you get a mammogram within 6 months. Why would I get it within 6 months? I just had the mammogram. I'm not going to go get another one. And I've had, and I'm not kidding, probably, I want to say about 50 to 100 patients over 20 years fight me. I mean, fight me. One of them was a physician, a doctor, fight me on getting a mammogram within 6 months. Why would I get you to, is it because I want to waste money? Terry, when did your mammogram change over what period of time?
6 months.
6 months. Literally, her mammogram was normal. 6 months later was abnormal. So I'm not going to rearrange your whole breast, move shit around, take cancer from here and stick it over there and whatnot, and not have a mammogram to make sure that nothing's changed in you. I have my sister as perfect proof. Funny enough, the lady, one of the many people who give me a hard time, one of them was a doctor. She literally gave me so much attitude. And then I said, listen, it's non-negotiable. You either do it or you don't. And I understand you don't want to do it. I can't help you. I'm not going to do your surgery. She did it huffing and puffing. I swear to God, I'm going to pull this. I have it on. And then what do you know? They found a mass. Mind you, it came back as benign. She wrote me the most apologetic email. I'm so sorry. I understand. Now I understand. I didn't mean to be da-da-da. She busted my balls over her health when I wanted to do that. And sure enough, they found a change. Thank God for her. It came back benign. But that's why I require 6-month change mammograms, okay? So if your doctor is top notch, don't fight him. Just go get the goddamn mammogram. My insurance won't pay for it. It's $180. That's in Beverly Hills. It's $100 wherever the hell you are. Walk in. Hi, how are you? What's your cash price for a mammogram? It's $85. It's $125. Thank you. Ding. Move on. Don't give me all, well, my insurance won't pre-authorize it. And my doctor, don't give me all that nonsense. Go pay for the goddamn thing, get it on, and move on. Okay, you're about to drop thousands of dollars on breast surgery. You can pay another $100 and some odd. Then, very common, they go get their mammogram because it's just, we need it. And they find something. And that's something, so when we get the mammogram back, the mammogram gets a score. It gets a rating, right? The rating is a 1, a 2, a 3, a 4, and a 5. They're called, and a 0. And it's a BI-RADS, that's their name. BI-RAD 1, a BI-RAD 2, a BI-RAD 3, and so on and so forth. 1 and 2, you're good. Everything looks normal, you're clean, you get a clean health, I can operate on you. 4, 5, God forbid, terrible. And then there's a lot of 3s. And we're getting more and more 3s. And what is a 3? A 3 is we found something. It's very, very likely to be benign. We're not sure. Come back in 6 months. And why do we get more and more of them? Because radiologists don't want to have to make a call. Because if they call that a 1 or 2 and it turns into a 4, then they told you were fine and they're going to get sued. So what they're going to do is they're going to call it a 3 and have you come back in 6 months. Okay? Now, what's the problem with that when it comes to surgery? That 3 is going to sometimes go on for years, because I've had patients that have been 3s for years because they keep kicking the can forward, meaning you come back in 6 months, they redo the mammogram, they get an ultrasound, they do an MRI, and they're like, yeah, it still looks benign, but why don't you come back in 6 months? Why don't you come back in 6 months? And so this woman is like, I want to get breast surgery. What do you mean? I want to move on with my life. Is it something or is it not something? Pick a lane. So what do we have you do in my office? We have you get a biopsy. That's the way to find out. They literally stick a needle in, they pluck out some cells, they look under a microscope. Then you will have a more definitive answer. And we ask you to do that so you can, have a, because this idea of it's like, it's probably come back, it's nerve-wracking. People are stressed and they want to know an answer. I don't maybe mind 6 months, but not for like 3 years. So we in the office say, hey, I'm not going to operate on you until you have a definitive. So we ask them to go ahead and get a biopsy. The radiologist will fight you on it. Nah, it's not necessary, just come back. But if you want A, a clear mind, and B, you want to undergo surgery, you need an answer. And so we force it, well, it's not 100%, I mean, they're taking little biopsies. They're not, the whole sample, there's what's called sampling error, but it's way better than you just not knowing what that, often it's a small mass. It's a cyst, it's a fibroadenoma, whatever, and they can tell you more or less it's good. So we ask you to go ahead and make a definitive decision. And as a result, I've done hundreds and hundreds of surgeries where the patient came back with a BI-RADS 3. They want to have surgery in like a month. The radiologist is like, come back in 6 months, we'll talk about it. They're like, what do you mean come back in 6 months? I'm scheduled for surgery. So we recommend that they get a biopsy. They get a biopsy, it's all clear, they go on and move on. The last and probably the most important aspect of the things that I recommend and I do in my practice is that when I do a breast surgery, and that means a breast lift or reduction, right? Often I remove breast tissue, right? Obviously a breast reduction, I remove tissue. But even my breast lifts, I remove a little bit of tissue. So I'm removing it to reshape your breast, right? What do I do with the breast tissue? You have a clear mammogram. Your mammogram is clear. Obviously, I wouldn't have operated on you. So I have that breast tissue. What do I do with it? What do most doctors do?
Throw it out.
Throw it in the trash, right? I mean, I just did a breast reduction. Let's get going. I send all of your tissue for pathology, right? I separate your right and left breast. Not only do I separate your right and left breasts, I separate the breast tissue I remove by quadrant. This is the outer quadrant. This is the inner quadrant. This is the bottom quadrant. I put stitches in them so that that tissue, when it goes to the pathologist and they're looking under a microscope, they know where the hell it came from in the breast. Right? It orients them. Right? And why would I do that? Why would I send you had a clean mammogram or an MRI, your OBs checked you, you have no breast cancer, you came in, you're getting a breast lift, it's just a cosmetic surgery and you're leaving. Terry, why would I bother sending this for pathology? Do I have some friends in the pathology department, they need some extra money?
Just extra caution. You have to make sure now that it has the physical breast tissue versus an MRI.
Right. Nothing is more accurate than the damn tissue, right? All of these other things are trying to see what the tissue's like.
Correct.
So I send it because then the pathologist will take samples and look under a microscope. And in the past 20 years, I have had multiple, not hundreds, not thousands, but I have multiple cases of breast cancer come back incidentally. And our cousin had that happen to her. I've had it on 2 or 3 patients. I had a patient, and we basically saved their lives. It was the last hurrah. Breast self-exam normal, mammogram normal, history da-da-da-da-da-da-da. This was the last checkpoint. We throw the tissue in the trash. They go live their lives. A year to 2 years later, they get disseminated breast cancer because I've rearranged all this shit. And we send it, and we've caught several breast cancers in the past 20 years. And as a result, I do that for everybody, right? So this is my protocol. Now, every doctor will do whatever the heck they need, thinks is right or whatever. But as a potential patient, you want to know that these things are available to you. And at what age do I send that breast tissue? I used to send it for patients 40 and older, right? But now with breast cancer occurring in women at like 32, 29, 30, I send it pretty much almost in every patient unless you're like 19 years old or 23 years old. I send it, again, why? What's the downside? The pathology for us is like $120. Like I've secured a cash price. Like I don't know how much it is, but I know that it's affordable, and I'm not gonna risk your life for some small nominal amount of money. So, at any rate, that's really the key to this episode is I am about to have breast surgery, and what are the things that I need to do, and how do I prepare so that I have the best health? Because while vanity and looking great and pretty is important, it never is trumps your health, right?
Absolutely.
Any other advice that you give to women who are wanting to have like anything other than what we talked about?
No, I'm very vigilant. I always, when I see people, I make sure that they do their self breast exam and the mammogram, because you have, like you said, you have no idea how many people I've talked to. Oh, I'm young. Oh, I don't need to. Oh, I'm scared to see what they're going to find. You would think that they would be a lot more vigilant about it, but since I'm a proof that that's how I found mine, I am such a big advocate of having them do that, because it makes such a huge difference in their health, God forbid, if they ever find something. So I make a point every time.
Yeah, on that note, before we wrap it up, it's really interesting to me because I obviously see thousands of patients a year, right? So I ask everybody, hey, when was your last mammogram? And I'm talking like 48-year-old woman. They look at me, they're like lawyers, CFOs of companies, like really like top-notch people, Harvard graduate. So you're 48. Okay, when was your last mammogram? Expecting them to be like 6 months, 8 months. They're like, Never? I'm like, what? And they know that it's wrong, but there is this denial component, this exact thing that you mentioned, which is this fear of, I don't actually want to know, which is crazy, right? Because it's insane, because it's curable, preventable, whatever. So definitely, you got to be your own advocate. You have to be aggressive, 100%. And there are very few cancers that we can screen, right? Mm-hmm. Like colon cancer, cervical cancer. What happens if you get cancer of your pancreas? Tough shit. Like you might pick it up in a lab, but that's neither here nor there. You're just going to get it, right? But breast cancer, for the love of God, you need to at least we have things that can screen it. So go do it, all right? All right, well, anyways, that wraps up this really important and fascinating and educational episode of Plastic Surgery Uncensored. Terry, thank you for joining us.
Thank you.
As always, our exiting two requests. Number one, if you find this podcast helpful or educational, share it with the people you love. For example, this episode, you don't know if your sister, your cousin, your aunt, your best friend is paying attention to these things. So share these episodes with friends and family. And secondly, if you enjoyed the podcast, go write something nice. I promise you, it really helps invigorate everybody that's here on a Sunday, working their asses off to create this content for you. It makes everyone happy. And more importantly, it raises the ranking of this podcast, which means that it gets pushed out to more people, and so the content is available for other people. So we greatly appreciate it. As always, thank you for joining us. I'm your host, Dr. Rady Rahban, and I will see you next week on Plastic Surgery Uncensored.